Good morning. This is Dr. Timothy Scott back here at LifePoint Medical. I'm giving you my weekly update on what's going on around LifePoint. I want to say thank you very much for listening to us. It is March the 20th, and tomorrow is the first day of spring. That's something to celebrate, if nothing else. So let's go ahead. I want to give you a clinical pearl up front, or at least talk to you about something that might be beneficial to you. Let's talk about neck pain. Okay. Neck pain is extremely common, okay? And most people, probably all people, experience some form of neck pain in their lifetime, okay? And it can be anywhere from a crick in your neck to where your neck is locked down and you can't move. And there's people like that we see somewhat often, not every day, but it's something we do. And sometimes neck pain is related to trauma. Sometimes it's related to old age or aging, or sometimes it's just a spontaneous muscle spasm or an irritated nerve that really hurts people. Sometimes neck pain can be a sign of a bad infection or something like that, but that's rarely the case. Especially, I don't see that much here in the office. But let's just talk about the most common form of neck pain is due to arthritis, usually mild arthritis in the neck. It can, and it's going to affect your range of motion, how far you can go, and usually it's not related to trauma, so to speak. So people come in and they're talking to me about their neck hurting, and they haven't fell and hit their neck or been in a car accident and had whiplash or something like that. So it's usually musculoskeletal in nature. And it can be mediated with therapy most of the time. So, so anyway, we address it a lot. You got to be a little peculiar with the neck because you can't give injections and things like that in the neck. At least we can't do it blindly because of the complications related to that. So, the main modality that I use for neck pain treatment is physical therapy. Okay, and we are blessed with some really good physical therapists in this community, and they really know how to help people with their neck pain. So if you are having aggravating neck pain and it's been going on for years, the first thing to do is come see us and let us examine you. And then most of the time I will refer you to physical therapy and let them try to fix you and try to get you comfortable. And that's always preferred because there's no medicine involved. And if they can get you feeling better, with just manipulation and exercises and different things, that's way superior to anything else. Now, I have chronic neck pain, and it flares up on me about twice a year, and that's where I go to physical therapy, and I let them help me, and they know what to do, and they do a really good job at it, and hence I only have to go about twice a year. Funny thing is, I don't even have to tell them why I'm there. They usually know. So, but you also have medicines like your anti-inflammatories or your steroids and stuff that will help with the neck pain, but the best thing you can do is physical therapy. Now, if you got neck pain and you go to physical therapy and it can't be fixed and it can't be mediated, then that's when we start looking at doing x-rays or doing MRIs or referring you to a specialist to help us look at your neck and try to figure out how to become pain-free. So we have an algorithm, we go through that, and a lot of it depends on what you're feeling, how bad the pain is, and how disruptive it is to your life. But neck pain's a real thing. If you got neck pain, come in and talk to us about it. We'll give you our best evaluation and try to figure out what we can do for you to keep you safe and to keep you comfortable, even if you are having neck pain. All right, next thing on my list is the weight loss shots are doing well. Remember, if you got a commercial insurance, you want to come and see us before you do the shot so we can see if we can try to get it to you through your insurance company. We haven't had that much success doing it, but we will try. The other thing, people are losing maybe 4 to 6 pounds per week on average is what I'm seeing. And I don't know how much effort they're putting into it, okay, but they're definitely aware of it since they're paying for them. And I'm thinking, that if you could lose 6 pounds a week for a month or two, that would be a huge, big deal for you, and it'd be extremely positive for your overall health, particularly if you're overweight, largely overweight. So we're still doing it. We're interested. We want to talk to you about it. We'll work with you. We're just trying to help people improve their health. And this is one modality I think is good. And I want to talk to you about it because one of the things that I want to emphasize with any time of weight loss program is what and how do you stay at your weight when you get there. And that's tough. And that's what we've got to think about and try to help you with, okay? Because as much as I like to help people lose their weight, I'd much rather help them stay not overweight, okay? And it's tough. It's not an easy thing. The RPM and CCM programs are going good. We are getting a lot of feedback. Some of it's negative. I just have to remind everybody that this wasn't my idea. This was Medicare, and we're late coming to the scene, and we're doing our best to cooperate with the rules and how things are supposed to be done with it and try to honor the spirit of it. Now, I will tell you that I have made some pretty good clinical decisions based on RPM readings. In other words, I'm reaching out to people when their readings aren't good and trying to mediate that so that they don't suffer unnecessarily. So it is working. A lot of people don't like it. I get it because it's new. And like I said, I didn't come up with the program, but I am trying to use it with the spirit of what it's set up for. And that's to take care of you. And last but not least, I do want to let you know that staffing is an issue here in the office, keeping workers and keeping employed. If somebody comes in and they're a really good worker, they're probably going to want to change. They want to move on. They want to better their life. They want to get more education. I totally get that. It's just hard because we have to survive what happens here, and there's a lot of things about what we do that make it hard to find people to work for us. Like you've got to be very fluent with a computer to show up hardly, and that's tough. The technology is tough, but the main thing I'll ask is you guys just be cooperative with us as we struggle through this, and I don't think it's going to be going away that soon. And we've come up with some innovative ways to compensate for us not having staff that we need here. So your cooperation and your is very much appreciated, and I thank it. And remember, I have like 5 full-time people answering the phones. Okay, so I know I get complaints about the phones, but I really am trying. We're trying to keep it so that we can answer the phone and get you taken care of in the appropriate manner. So thanks again for your cooperation in that, and we're going to just keep working and do the best we can and trying to keep ourselves out of trouble. You have a wonderful day, a wonderful week. You call us if you need anything. Thank you.